Hello everyone, Dr. John here at today's Headache and Facial Pain Institute. In this video, I want to cover one of the most important pieces of advice that we give the majority of our patients in terms of helping them to self-manage their head pain problem. Regardless of the symptoms that you are experiencing, whether they are headaches, migraines, jaw pain, facial pain, TMJ, ear pain, um, it doesn't matter what type of pain you're suffering from, there usually is an underlying component that is causing your pain. And many of these type of problems are due to how you have been using your jaws and your teeth and the type of foods that you choose to eat on a regular basis. So that is the premise of this video, is to teach you the importance of a soft diet and what you can do to self-manage and help to alleviate and reduce the symptoms that you are experiencing. So before we do that, I want to give you a little anatomy lesson so you can understand why we recommend a soft diet. Now, when we recommend a soft diet, a lot of patients say, oh my God, am I going to have to be on mashed potatoes and soups and smoothies for the rest of my life? We're not talking about that. In a second, we'll cover some of the foods that you should choose to eat, and particularly how you chew those foods. That is the most important factor in being able to start controlling your pain. So if you take a head, even though I have an artificial head here, you have your two jaws, your maxilla and your mandible. Your maxilla is tied to your upper skull bone. It is fixed to the skull bone. Your lower jaw moves back and forth. A lot of people think that the upper jaw actually moves to the right when we tell you to move your jaw to the right. It's only the lower jaw, the mandible, that is able to move back and forth, open, close, side to side. Now, if you take the muscles and the ligaments off of your lower jaw, it will fall to the ground because it is tied to your skull bone by way of muscles and ligaments. It is not fixed to your skull. So when when everything fits together properly and you use your teeth to chew food, the jaw connects here to your skull bone by way of, again, muscles and ligaments, and there is a shock absorber called an articular disc cartilage that is about the size of my thumb, of my finger, and that piece of cartilage acts as a brake pad for your jaw and protects your brain and your skull bone. Similar to how a brake stops your car, or the bottom of your tennis shoes protect your feet, or your tires drive your car comfortably and your wheels are not ruined, that cartilage protects your skull bone, your brain, and your jaws. The condyle is the top of your jawbone that connects up into the skull bone. So when you're chewing food with your teeth, you're actually stopping the jaw in the right position, and you are not damaging the cartilage, especially if you know how to chew correctly and you choose the right foods for that. What happens over time is that your bite can get worn out, and the bite wears out if you have a habit of chewing a lot of thin vegetables like spinach and lettuce and kale and veggies that are very thin. Those type of foods cause you to crunch your back teeth hard together and move and crunch up that food. So subsequently, when you do that excessively, that jaw joint will start to wear out. So that cartilage begins a slow wear and tear because your teeth also begin to wear out. And that type of degeneration is what leads to pain problems over time, because if you lose that cartilage, you're now pressing most of that stress from your jaw goes inside of your brain, and that's where you get the headaches and the migraines, or next to your ear and you get the ear pain. So when we tell you to go on a soft diet, we're really talking about the thin foods, the lettuce, the spinach, the kale, those type of foods. We're also talking about not chewing gum, which is really the worst thing. Um, Understand one thing here. Uh, as human beings, we use our jaws roughly 3,000 times a day. We open and close roughly 3,000 times a day. 1,000 times for speaking, 1,000 times for swallowing, and 1,000 times for physically chewing your food. In a 24-hour period, we're supposed to touch our teeth together only about 24 minutes. Now, let's add to that component a person that clenches their teeth and chews thin vegetables on a regular basis. You are now approaching 20,000 times or more of physically biting these teeth together, wearing them out, and then subsequently, again, wearing out the cartilage. So you see how important it is to take a break from that abuse and follow what we call a soft diet. Again, a piece of chicken or fish or beef or maybe even a pork chop, it's not considered thin food because you can put that piece of meat between your teeth and you can chew it and you can move it around where you're not physically having to bite your teeth together like you do when you chew some thin foods. So that's actually acceptable. You can chew that. You don't have to worry about it because you're not biting your teeth together, which causes the main damage to your cartilage and your joint. Furthermore, we always recommend steaming your vegetables, regardless of the vegetable. Steaming the vegetables removes the pesticides and the herbicides and some of the chemicals that we find on our vegetables today. Furthermore, broccoli and kale and even cauliflower and spinach to a certain extent should always be steamed. Broccoli and cauliflower and kale have goiters on them, so they can affect your thyroid gland when they're not removed by steaming. So those type of vegetables should always be steamed, and the rest of them should be, of course, for your self-management situation, should be steamed, should be soft, make it at least a little easier for you to be able to chew them and not damage the joint. Now, of course, there are other factors in terms of the type of bite that you have, whether you have lost your teeth. There are neck components that come into play, but those are all on other videos that we talk about. Right now, we really want to stress to you the soft diet, your choice of foods, and how you can make a big difference and start to see some improvement and some reduction in your pain by paying attention to how you use your jaws and your teeth. Now, if you clench, obviously we're going to give you some sort of mouthpiece to help break the clenching habit and relax the musculature and get you some pain reduction. If we're diagnosing you with a joint problem or extensive or chronic damage to your joint, then there's a phase 2 type treatment that we will talk to you about. Again, for this video, we're just giving you this advice so you can learn to manage your problem and really understand how many times during a 24-hour period you should use your teeth and how many times you actually might be abusing your teeth, and you need to stop that because your allowance of using your teeth and your jaws is probably expired. So we'll get you back to that normal chewing and normal type of activity that you like with your foods, but it may take a little time to get you there. In the meantime, you've got to follow the soft diet recommendation. If you have any questions, call our office, email us, text us, and we'll be able to answer your questions. But for the time being, I hope that this advice gives you some ability and a different perspective on what we're talking about when we give you the advice to follow a soft diet.